Hello, everyone. My name is Kimberly Loza, and my presentation is over psychoeducational groups. A psychoeducational group, they are forms of group therapy that is less focused on developing relationships between clients and instead focus on providing education through information sharing and the development of coping mechanisms. Um, I've been fortunate enough that within my own internship, I've been able to participate in a couple of psychoeducational groups. One example I have is being a part of a parent support group for patients who are diagnosed with Prader-Willi syndrome. And within this group, what we focused on was providing the parents with um, behavior intervention strategies, um, calorie-stricken diets, and ways that they can help the patients be successful once they leave the hospital. Because for these patients, their one struggle is they're always food motivated, they are always seeking food, and this group really focused on helping the families cope, showing them that they weren't alone in this, and gave them as much information possible to help not only the family be successful in the patient's progress, but for the patient themselves to also be successful. There are many benefits to this group. In these groups, the clients themselves get that sense of togetherness. The feelings of isolation and loneliness can be reduced through attendance, especially when clients realize that they're not alone in this group, that they're not the only person that are struggling with these problems. They can also learn about their needs, learn practice skills in a safe environment, and they can also understand the challenges they might face and get assistance with external influence and begin developing strengths to help them learn and manage in order to move forward within their progress. I really like this group because it's a very educational group, being a part of it and seeing ways that the clients can learn in attendance to this group is really great to see. Some of the target populations are so diverse in this group. I mean, these groups can focus on helping those who struggle and their families who struggle with phobias, mental illness, substance abuse, domestic violence, trauma survivors, weight loss, chronic physical disease, anger management, grief, criminal behavior. I mean, the possibilities are kind of endless with this group, as long as they're providing some sort of education and helping those who are participating in the group cope with their struggles and giving them strategies that they need to be successful. That's really what psychoeducation is all about. It really doesn't focus on building relationships or anything. It's about educating those who are participating within the group. Topics within this group also can be very diverse. Some examples are they can focus on positive thinking skills, anger management, people skills, soft skills, conflict management, visualization activities, choice points, communication, stress management, forgiveness, and interpersonal communication. An example of this that I have for myself within my field placement is I was able to facilitate a psychoeducational group, but that focused on social emotional learning. The patients that I worked with, a lot of them struggled with coping with certain emotions, anger management. They struggled with anger issues. And what my group would focus on, we would focus on ways we can cope with our emotions, providing them those social emotional skills that they could use not only within that hospital to help them progress through their treatment, but also to help them be successful outside of the hospital, giving them skills that they could use every day and help them stay on track and keep them from going into the hospital again, which I was very fortunate to be a part of that group. I loved it so much. Some barriers with this group, as I said before, it really doesn't focus on building group cohesion, building those relationships. Actually, that's like a lack of focus for this group. They focus more on educating those who are participating. And you may have those who clash with one another because you have such a diverse group. So you may have those that clash with one another. And you may also have those who are unwilling to be educated, like for example those who struggle with substance abuse. They may be forced to participate in this group, and they may not be willing to learn about the drugs, how the drugs can affect them, how ways they can cope with it. They may not want to be cooperative at all. You may also have patients or clients who don't accept their diagnosis or traumas. I know, for example, when I did my family group, we had a couple of parents that they just didn't want to accept all the responsibilities that they were going to have to take on in order to help their child be successful. And that was really tough to see, but eventually they got to a point where it's like, no, I need to learn what all I'm being taught in order to help my child. And that is my presentation. I hope you all enjoyed, and I thank you all so much.